Welcome everyone. Thank you for attending today's webinar. My name is Donna Chow and I am your host and moderator for today's class by eLotus, your leading provider of TCM education. We have been hosting educational courses for over 2 decades and we are proud to be your trusted source for premium CU content with over 200 speakers, 700 courses, and 3,000 hours of continuing education. Today's webinar is 10 practical expert-approved formula strategies for all herbalists with Laura Zaranski. There will be one break today and we're set to end at 1 p.m. For lecture notes, you can go ahead and download them directly from the blue course access page in your eLotus account. To use the chat room, go ahead and set your chat preference to everyone so that everyone can see what you're typing and be part of the conversation. To ask Laura a question, you can go ahead and enter your question into the Q&A box. And finally, today's class, there are no CEUs as it is for educational purposes only. So we hope you guys enjoy the webinar. Today's speaker is Laura Zaranski, and she will talk about the top evergreen formulas that are very popular among her patients. This webinar is perfect for new practitioners, acupuncturists who didn't learn about herbs in school, or anyone who just loves to learn. You can find more information about the formulas that Laura will be sharing in our clinical manual of Oriental medicine. I'll send you guys the link for it in just a bit. All right, let's get started with class today. Laura, are you able to go ahead and take over by sharing your PowerPoint, please?
All right, we're ready to rock.
Go ahead, Laura.
Oh, what happened? Me and electronics. Hi, guys. Welcome, everybody. I'm glad to be here today to walk you through some of the most commonly used herbs that we use in our clinic here. Just a kind of a background on me very quickly. My name is Laura Zaranski. I have a master's degree in Chinese medicine from Midwest College of Oriental Medicine. I also have an undergraduate degree in physiology, and I am going to move my phone away from here really quickly. Sorry. And I really, over the 25 years in practice here in Chesterton, Indiana, I have kind of come to sort of support the two medicines in a way that I kind of call macro and microphysiology. I really do believe that my undergraduate degree was more microphysiology. We learn what comes out of those kidneys, calcium, magnesium, absorbabilities, to the filtration of our body's wastes and all those things that we know of, and we understand the microchemicals of that. But I do believe that Chinese medicine is more of what I consider macro physiology, and that's the large picture of how the human body works, that we're an input-output system, and we also have to have flow. And so I've worked and dedicated a lot of my 25 years in practice to the integration of helping to communicate not the differences, but it's sort of like temperature, right? Just because something's hot doesn't mean it can't be cold, and they're part of the same spectrum. So I think that there's a big communications barrier between those things, and I've really dedicated my practice to understanding that. I am in my 25th year of practice, and we have also been using herbals forever. I've actually been studying herbs since I was 20 years old. Mostly with Michael Tierra's East-West School course in Western herbalism. And then I've gone on to study more through, obviously, Chinese medicine, which overall I feel is a superior diagnostic systems, the way that they integrate herbs, the way that we, energetics to temperature, to taste, to flavor, where Western herbs were kind of behind in that a little bit. And it was a little bit more, I feel a little bit more brought down through family lineage or folklore, without as much, obviously, background and consistent education and dedication to the classification of herbs and how we classify those. So Michael Tierra was an interesting, I think, start for me, because he's at the forefront of putting Western herbs into the Eastern model. So I have had extensive training in both Eastern and Western herbs, but I use mostly Eastern medicine, TCM, in my practice. Western herbs come into play a lot, though, for the ease of if the client's not with me, if they're a weekend and they call and they can't get into the clinic to pick up an herb, then a lot of times knowing your Western herbs are really helpful to be able to get them to a health food store or to Walgreens or things like this as well, because they are now carrying herbs in those ways. So that's a little bit of me. I have trained with Jimmy Chang. I've done pulse diagnostics with him. I've done a lot of my continuing end with John Chen. And I've been using herbs, the evergreen herbs in my clinic for over 10 years, if not longer. So I really feel that the best thing is they'd always talk about communications here too. And if you've ever read some of the clinical manual of Oriental medicine, you know that Evergreen and Lotus is very dedicated to the communication and understanding of Eastern pharmacology Eastern medicine and Western pharmacology. So I really believe that there's so much benefit to Lotus and Evergreens. So it's a very useful thing for me. The purpose of today is, I feel, to express. I think I passed a thing. Sorry, guys, I'm not excessively techie, so I apologize for that. So let me see if I can get back. There we go. Yeah, so the purpose today was to support the TCM community. I want to make sure that if you guys have any questions or anything that you reach out, but to support the TCM community in herbology studies, clinical outcomes, and the integration of herbs into the clinical setting in an efficient and effective way. There are quite a few acupuncturists in our area, and many of them do not have much herbal training, so they feel often uncomfortable using herbs. And often even refer their clients to us to be able to do herbal formulas, because they're such a big part of what we do every day. I don't think there's any client that does not actually walk out the door with an herb. It is mostly necessary in most conditions. So the purpose for you is, please feel free to express, why you're on this seminar. If you have any questions you have, or you have any particular questions, feel free to reach out. I don't know if I can hear you or not. But if not, there is the chat button. So please feel free to ask or get those questions asked. And then there will be a little brief break at about 11:30 so that we can all take a quick break, reset, and then get back in. So I'm just letting you know. And then just for everybody, if your mics are loud, you got dogs behind you or phones like I just had, we'll try to remove those, but it does happen. So we understand that, no big deal. But again, thank you for being here today, supporting us, supporting me, Evie Herbs and the Lotus Institute. I appreciate that very much. And I feel very honored and grateful to be here today. So as you can kind of see, I tried to sit here at my desk so that you can see that, we have our little herbal pharmacy behind us. When I first started herbs, I did feel it was a daunting task, even after understanding TCM pretty fully. Herbs are very complicated. I actually think they're one of the hardest things that we learn in TCM, because of the specifics of it too, and the diagnostics become so important. We know that in acupuncture, they're self-regulating, right? So sometimes we use stomach 36 for digestive problems that are due to excess or deficiency, and they're self-regulating. So they'll either tonify or they'll spread excess and things like that. But herbs become way more technical, right? We know that if we really don't have a good diagnostics and we decide to say, that person is actually hotter than they are, and we give them all hot herbs, we know that we are going to aggravate those types of conditions. They become much more important. But I also don't want, anybody out there, if you haven't started using herbs at all, to be scared or fearful. When I started at first, I was a little nervous, and I felt my diagnostics were fairly good, at least for very basic things, for sure. I mean, liver qi stagnation and spleen qi deficiency, there, you feel pretty comfortable with those. So I really started out with some of the very basic and most common formulas to try to use clinically, to make sure that I feel that I had a good understanding of them, how they worked, how patients responded, their compliance levels, and what was going to happen clinically. Because as we all start our practices out, a lot of times we don't really understand the complete clinical outcomes. Sometimes even in clinical school, like in our training, we don't. I didn't even get to see some of the patients more than a couple times. They might come on a different day than when I was doing my interning and all that other stuff. So working with other practitioners has been a huge benefit for my growth curve. And then also just taking my kind of just getting my feet wet, stepping into it, and trying that to my best degree to feel comfortable with it. So I really want everybody to not be afraid, even though they are hard and they can be technical and they can be slightly difficult, but not to be afraid of trying to use those, especially things like, free and easy wander or Jiaowan, these basic formulas that do come up. So today I hope to help you understand that, they aren't as scary as they are, and that there are really good ways to use them, even on a simple side, and then getting more and more complex as you get better at your own diagnostics and longevity of understanding our own medicine and our clinical outcomes. So why I use collection formulas is that I do believe that the Evergreen collection formulas, they are more geared to our American clients. I do see that they have more technical and specific herbs in them that help with a lot of the patterns that I do typically see here in Americans, because of a lot of times their diet, we know the climate, things like that. So they are amazing that way. I also use the collection formulas overall, and even EV herbs, because of the commitment to research, and they give a lot of credibility to the use of herbs. They have, the background and all the knowledge that we need to know from even studies that have been done. And that really is an important thing. And especially for our clients, we do get our clients a lot who are like, well, are they safe? Where do they come from? How do we know that they're safe, and these types of things? And I'm able to show the great quality that Evergreen has, and the safety of the use of these herbs. And they do such a great job of helping us even understand like things that have and contain like shellfish and things like that might have actual true allergic reactions to patients. I also think, speaking of allergic reactions, a lot of practitioners, I think, also are a little hesitant. They think that there might be, or patients are, let me put it that way, patients are a little hesitant of like, what if I have an allergic reaction to them? The reality is I've probably treated in the somewhere in the realm of about 20,000 patients. I've delivered over 100,000 treatments, and almost all of those patients have used herbs. And I would really literally probably be able to collect on my hands the number of true allergic reactions that we've had. And those typically will break out in hives, or sometimes I've had a little bit of a throat close. But most of the time, even if somebody breaking out in a rash isn't necessarily an allergic reaction to something, we have to take it with caution. We have to figure out what might be causing that. See if it is that. But the reality is most people will not have allergic reactions to herbs. But if you do know that a client has a known allergic reaction, then you obviously want to address that, take care of it, and do due diligence to make sure that you're not giving them something with those types of things in there. The other reason I use collection formulas is that they're extremely effective. I mean, extremely effective. And I've been using patent tea pills for a very long time, which are so easy to comply, and they have great longevity of shelf life. And so as a new practitioner, I did feel that capsules or tea pills or things like that were kind of easier at first to keep into my clinic. But as I've become more and more technical and better at what I do, having the powdered concentrates allow me to be much more comprehensive in my herbal remedies and prescriptions. But they are effective, and they're clinically proven. And when I say clinically proven, we keep track of every single patient that comes in our door in their clinical success and their outcomes. And I also have a lot of research, and we keep track of any medical tests that change. So I've had patients who've literally had GFRs lower than 20, 14, 15, 16, and 17 GFRs, which is kidney failure and dialysis putting in Western medicine. And we have used evergreen herbs to help them get out of those things and get back into normal functions. So sometimes if somebody's already on dialysis, I haven't had as much success with getting off of. They've already started this other process. And generally, when we take over for the function of something, then the function doesn't want to come back. And so depending on the length of the time that the client has been on dialysis, the ability to recover their kidney function gets a lot lower. The other issue, when people are that low in their functions, that way we don't know if we have enough time to fix it, right? Healing is also a time factor. Just like we always use the example of bodybuilding. You didn't just become a bodybuilder overnight. It was consistent and persistent dedication to lifestyle habits, diet and food. And that's the same thing with function of the body. So when the kidneys are kind of lower than 20%, you may not have enough time to really get that patient back up to good health. They might not even have enough energy. And in some cases, it could literally be impossible. So in those cases, it is important to make sure that you're referring back to your Western doctors in those cases if you don't see things happening in a short amount of time. I do feel that there are times that you can take a little bit of effort to see if it will take hold, but I wouldn't go longer than about 3 months if I didn't see much clinical change. And with these herbs, we see clinical changes on average for most deficiencies on blood tests within 3 months, and in some cases even within a month or less. But 3 months seems to be the tipping point where you start to really see the building of the deficiencies taking over for what they're expending in their lifestyle every day, and then also being able to beat that out and finally start to see clinical changes on lab tests. So we've worked on reversal of liver function, kidney function, heart disease, lung dysfunction, COPD, things like that. And we've had proven track success with these herbs in getting them back into normal ranges. And my average client might even come in here with, a 35 or a 50 GFR, things like that. But remembering that hypertension is even called stage 2 kidney disease in Western medicine. So that could be a GFR of over 60, which would be considered normal on a test. And some tests will only say that the function's over 60 on the GFR. So if you don't have a specific one, you might not be able to know that. But just having hypertension is already indication of stage 2 kidney disease by Western medical standards. So, but they are extremely effective. Recently, again, liver enzymes that have been super high, we've been able to see those come back in. So these herbs work, and they work really well. And I've seen them clinically proved on multiple clients. Just recently, I have a 80-year-old who came in with neuropathies in his feet, GFR at 38. He's been with me since about March, and his last blood test last month already has him at a GFR of 58. His neuropathy is finally feeling his feet overall. He can move them. They weren't even responding to e-stim for a while. But it's just persistency and time a lot of times. And I think sometimes we undermine our own clinical success because we aren't either patient enough, or we don't have enough time, or the patient isn't compliant enough. So that is the next step, is that clinical compliance is important. And I do find with these herbals that they taste pretty good most of the time, unless you're using like Wang Lian Shidu San Wan or something like that, super bitter. I taste all the herbs a lot of times when I give them to my patients. We usually give them a little taste tester when we're going to put them on customs, so that I like to mix them up and just take a quick taste before I even give it to the patient, so that I understand the level of bitterness or taste disturbances. If they taste pretty good, like Weepy One or Zhurgan Sao One or something like that, I kind of laugh then when a patient's like, oh God, that tastes bad. But I know then the patient's going to have maybe a hard time. I'm going to have to talk to them more about it. But if they can tolerate, these really bitter herbs with no problems, then we know that they're not going to have many issues. So I like to taste the herb a little bit prior to giving it to the patient, so that I can see where that level of kind of distaste might be. But the Evergreen formulas are amazing. They are great. I don't need to use a lot of water to dissolve them, and we usually do drink them and take them down as a shot. But I do get good success with clinical compliance most of the time, and especially if I talk to the patient a little bit about that beforehand. The other reason I use them is that their cost, the benefits for the clinic. I like the formulas over, raw herbs, like completely individual. Now, I do have some individual herbs because sometimes you do need them. You might need to add more. We know sometimes just Wang Qi on its own is very, very important in deficiencies and prolapses, and we might want to actually add up just Wang Qi into a formula. I think Buzong Yiqi Wan uses like something like 50 grams of it in there, if I remember right. But it's interesting how a lot of these are there. So the cost effectiveness in using formulas is helpful because you'll more likely go through those herbs quicker than if you have them individual and don't use them very often. So if you're just starting out your clinical pharmacy, your herbal pharmacy, then I would, consider using formulas most often. And some people, I think, have stayed away from that because they often don't know that you can mix a lot of the formulas together and just know the basis, which is what we're going to be talking about today. And they're also a more cost-effective to the patient as well. We're talking about customs in general, because when I start having to pull off capsules or pills and I have a very complex pattern, I might need 4 different bottles, and that starts to become a little less cost effective to the patient than if I was able to put everything into one formula and have them be used that way. The other thing, and I'm not sure where it's at in this formula, if I have it on another slide, but the other thing is that I've found over time, when I first started my practice, I didn't have much clinic problems with patients taking herbs that we recommended in tea pills and stuff. But then as the internet came in and the websites come up, patients would often go back home and then Google them and look up the formulas and then try to order them online. And I was having some problems with that because they would often buy 6 bottles of it. And then 3 weeks later, I'd have to change the formula. And they're like, but I just bought 6 of them online and other things like that. So what I have found is that even clinically using concentrates, it sort of helps to, again, it's not that I would want them not to take it that way, but you can't control them. You don't know if the safety is there, if they're getting them online. And they often have even bought formulas that they thought was Free and Easy Wonder or Jiayawan. And when they brought the bottles back to me, they were modified formulas from a certain company that it wasn't the classic formula. So you have more track of being able to keep track of all that. And it makes you a little bit more specific. It makes it a little bit more technical why you're doing what you're doing herbally. And they work though, and they're fast. So that's the big thing. So, oh, geez, how did that happen? How does that happen? Hold on, guys. Sorry about that. Where do I go? Here we go. Sorry. Okay, thanks. Introduction of how I use granules. Typically, I try to determine the top 2 most prevalent TCM diagnostic patterns, okay? So, and I always have to keep in mind their top complaints. I do feel that sometimes people can get sidetracked onto things that they might be good at or what they think is more critical to the patient. But in the forefront of my mind is what brought that patient into me at first, which is often pain. But really remembering that pain won't go away if those organ systems are not working correctly, because the body is being used as fuel sourcing every single day, whether or not we're healthy or not, right? We break down muscle, we build it back up with our food. And athletes have to have the input output pretty accurate or they're going to stay in pain all the time. So by the time people come to me, which is, pretty far down their health profile a lot of times, right? They've already had something in place for 4 or 5 years, even up to 20 to 40 years in place already. And we're in the second stage of health problems like blood pressure and cholesterol and diabetic and on 4 or 5 medications, and they want their back pain gone. But I can't forget that's what that brought them in for. And that's still got to be one of the major things that I treat, or I will start to become insignificant to them, or they might feel that we're not really listening to them to help them. So we never want to lose sight of that. But I will always pick the top 2 most important diagnostic patterns, like is it spleen Qi deficiency or more liver Qi stagnation or more blood deficiency or more kidney yin deficiency, and focus on those and trying to find those right formulas that will treat the majority of their symptoms. When a patient first comes in, I will often look at, maybe only using like two formulas right away. Sometimes I even do start them off on capsules or tea pills so that I can just have it very simple, easy, see how they respond, watch the rate of responses with me, not be too complicated, and then realize there is maybe more dampness than I thought or something like that. So I will only start with 2 of those. Okay, thank you. And I'm reading through a little bit of these things too. Sorry about that, guys. Excellent. I got a question I'm going to answer. So I never lose sight of those, and I will pick those things and I try that first. We go through about 4 treatment protocols to sort of see how they respond. And then at that point, we sit down in our clinic and discuss what we need to do to help them achieve optimum health. And that could be very different for different patients. And then I will explain what we need to do to get there. And at that point, that's when I often introduce the granules and things like that. And because most of the time people have 6 to 8 patterns of TCM. It's really true, from liver qi stagnation with spleen qi deficiency, dampness, blood deficiency, kidney qi deficiencies, heart excess, heat, no, right? They have these complicated patterns, and we don't need to address every single one of those TCM patterns. We need to pick the biggest ones that actually work on the majority of problems. I kind of consider it like a assembly line. When you start to address the major problems, the rest of everybody kind of comes into line. So somebody on the webinar asked, please explain more about your kidney protocol for low GFRs. And so it is a combination of everything. I use TCM to its complete fullest in our clinic. We use, acupuncture and moxibustion. We use herbs. We use Tui Na. We'll use exercise, diet, lifestyle habits like meditation. And in some cases, we actually have to look at astrology because honestly, I will tell you that wind and damp aggravate people's conditions on any given day more than anything I've ever seen. So we are going to go a little bit more through the TCM protocols or what I do for kidneys. So when we get to that point with the kidney DTX, we will talk about that a little bit more. So we'll answer those questions for sure. And then let's see, I also have to consider like the age of the patient, the length of the problem, any medical interactions, their diet, what their lifestyle is like, do they exercise or not? And I also will always try to address the excess first. And this could be with acupuncture. So a lot of times I find that some people will try to clear all the excesses with herbs. And I think it's effective, but I've also seen it be less effective than trying to treat the deficiencies or the tonification with your herbs, even early, even if there's an excess, because often the excess is due to the deficiency, right? So like even blood deficiency can lead to blood stagnation. And the way that I sort of describe that is that if you have a creek and the water goes around a bend, it's way easier to dry up or stop and get stagnated than if you have a full river, right? So once you have full blood quality and quantity, then it's less likely to stagnate. So the truth is that we really have to tonify that deficiency of blood, and we can use needles to move the stagnation, right? So I don't necessarily have to have blood circulators in there unless their tongue and pulse show a ton of purple, which a lot of times it does not. Most of the time in those types of conditions, it doesn't even show purple. So I like to use the tonifying herbs early in care with excess too, but it should always be considered as the tonifying is the hardest and slowest to change. So we always want to try to address it. And actually I find that tonifying through needling is harder than with herbs. So with that, let me see here. Okay. All right. So let's see here. Okay. Okay. So deficiencies versus excesses, address the top issues with herbs, especially the deficiencies, and the secondaries will often subside. In that case too, there was, what was I going to say? Deficiencies versus excess. Oh, the diet itself is also a tonification to deficiencies, right? So we also have to think about what they're eating, because their food is also something that can build deficiencies, and it can also aggravate excesses for sure. But again, the deficiencies are the hardest things to treat, not the excesses. And the deficiencies are the ones that, like I said, take the longest. And I think sometimes we don't spend enough time tonifying the deficiencies as long as we should. So as I told you earlier, we keep clinical track of every treatment that we perform here, every client that we work with. And I have had patients who will not take herbs, either because of cost or fear. And I've had patients who will only do acupuncture. And what I found is that I can clear a lot of the excesses with the needles. I can calm down the nervous system, which allows their body to start absorbing nutrients better, obviously releasing more serotonin that way too, because the majority of serotonin is built in our small intestine. And I can see those things getting getting better with acupuncture. But what I found is, like, let's just say I had somebody with a deficiency that might often take about 8 months to fully see the tongue and pulse changes. If they've only done acupuncture in that same amount of time at 8 months, their tongue and pulse can look almost exactly the same as when I started. And that was shocking to me. I thought, oh my gosh, I mean, that's crazy, because acupuncture can tonify. I don't want to, get you that there's a, you can't. You're moving and circulating more oxygen and blood. You definitely can. You could be absorbing more nutrients. But honestly, in terms of it changing the deficiency on the tongue and pulse, I was shocked to see that it rarely will happen, which to me means that that client could have those symptoms come back pretty quickly if they aren't using acupuncture as a maintenance tool. And I'd rather get my patients to a point where they don't need to have acupuncture all the time, because remember that the Chinese said, change the diet first. And if that doesn't work, then we go to acupuncture and herbs. So I think there's a lot in that, and it's very interesting. And then the other is true, where most of the time I could handle a lot of the deficiencies through herbs alone. And in some cases, that's all we do, or in cases where the client won't do acupuncture. And what I found is that it will work to change the underlying condition and symptoms, but it takes 2.5 times longer. And it will take 2.5 times longer for them to often even see sometimes physical changes, symptom changes with deficiencies we're talking about. And then they might not be compliant, because if in a month they are like, well, I don't see anything happening to me, and I don't think these herbs are working. And that's just not true. I mean, we might look at the tongue and pulse again, and we can start to see that they are building. But if you have to work from the ground up, sometimes you won't see the clinical outcome for 2.5 times, sometimes longer, than using acupuncture too. So we here use at our clinic acupuncture and herbs in almost every case, because in almost every case I have is they're necessary. In kids, not always. Sometimes in certain conditions of excess, sometimes obviously acute conditions like wind cold or wind heat, herbs alone might help too, and you might not even need acupuncture. But the other thing that we can do to tonify is also to use moxibustion, right? So that is a huge part of our practice, and I think a major important part of helping patients to get out of deficiencies quicker too. And we even have patients go home with moxiboxes. So excesses do respond great to acupuncture. So most of the time I just clear the excesses through needles, maybe gua sha, cupping, electric stim, exercise, possibly things like that. If the major problem and the tongue and pulse show mostly excesses, then I definitely will be using excessively used herbs. I'm not saying that they don't happen and I don't use them. I use them. It's just that more often the herbs are very important for the underlying deficiencies. So let's see here. The other things I have to consider in using herbs is the length of the problem. So the longer the deficiency has been in place, the longer it usually is to recover from that deficiency. But it's not always true. I know I hate to be like that, like that's not always true, it's true. But we know that not everything is foolproof and that there's always an exception to every rule. But the reality is that, yeah, if a patient's had a kidney problem in place for, 40 years, they're typically going to take longer than somebody who just got diagnosed with a thyroid dysfunction or something like that. That often can go a little bit quicker. If I've caught patients early in care before, like when they just found out that their TSHs went out or things like that, and I get them on Thyroforte, which is one of the formulas we're going to be discussing today, right away, I have had them change that condition within 1 month. Okay. And get their numbers back into range. Now, that doesn't mean they're off of herbs at that point yet, but at least clinically, I'm starting to get them into ranges that will make them less likely to have to go down the Western medical path. If they can see results that quickly, then sometimes they're more compliant, especially the patients who don't really want to take meds. Since we're talking about the thyroid a little bit right now, if patients have been on sometimes like Synthroid or Levo for 4 or 5 years, I have found it a lot harder to get them off of them. My theory is just that, again, it's the function of the thyroid has not been stimulated by TSH, which is thyroid stimulating hormone that tells the thyroid to produce the T3 and T4. And if that's been shut down for 4 or 5 years, sometimes it doesn't want to come back up. It doesn't really want to get stimulated again. Maybe there's been lack of blood circulation to those areas too long, but it does become harder. However, in most cases there, I've seen them be able to stabilize their condition better. And we are going to talk a little bit more about that down the road as well. So excesses do usually take their faster. I've seen in 4 treatments, blood stagnation, sometimes almost completely gone, excessive heat, liver heat, things like that be gone. Now, deficient heats, again, it's a deficiency. It takes longer. It will take longer to tonify if we have a deficient heat condition. And it's not uncommon to treat deficiencies with the same formula for months on end. I've worked with a lot of herbalists too, who are like changing their herb formulas every week, addressing the little nuances of the symptom that they're having that week or things like that. And I found them only chasing symptoms then and not really ever getting to the core of the problem. So I sort of jokingly say that, you know, spleen chi deficiency is spleen chi deficiency till spleen chi deficiency is gone. And how do we know that spleen chi deficiency is gone? Is that the tongue shows that it's a nice pink color, it's not pale, it's not swollen, not soggy pulses, not deficient pulses, things like that. That's what we're talking about when we're saying that it's not there anymore. And then blood deficiency does typically take again, in clinical outcomes, we have to be realistic a lot of times, right? Things do take time. So I don't have to always have everything done in a short amount of time. Or if I shove 10 treatments together and just to try to treat the symptom that also is due to a deficiency that's going to take time, I might end up doing 10 or 12 or even sometimes 20 more treatments than I needed if I could just explain to the patient that part of this is a time factor, consistency, not perfection, and that we're going to be using this until these symptoms are starting to abate, and then obviously that the tongue and pulse are gone. So I really do find that I think early on we might underestimate ourselves or think that got a wrong diagnostics. And most of the time it's just that we haven't given the problem a long enough time to change and be persistent with the same formulas. If your diagnostics are good, they're good and they're going to work, but you just sometimes need time. So don't underestimate yourself on that. Really try to think about why you decided that was the right and correct diagnostics and keep with it, because it's spleen chi deficiency till it's gone. So with blood deficiencies, though, it's interesting. We see this a lot. It's very common, obviously, to see. And what I found is that through herbs like siwuan or things like that, it takes me about maybe on average 3 months to see a very, very thin vessel start to look more like an actual vessel. So that's kind of, again, my tipping point. With deficiencies, you will see a lot of changes in about 3 months. So hold on to a little bit and keep your treatment strategies. You should see improvements in symptoms as you're going there. And then usually you'll start to see good tongue and pulse changes by about 3 months in on most conditions. And just so you know, what an average patient here might do if they have kidney chi deficiencies with spleen chi weakness, liver chi stagnation, maybe they're on 1 or 2 blood pressure medications, maybe they're taking an antidepressant, these are a common patient. They might need about 32 treatments, maybe even 38 treatments or so. I start with often twice a week for 8 weeks in most conditions. And we will often see a lot of positive changes in that period of time on the deficiencies of that. And so that's where we really do start. So if you're trying to figure out, when I say about 3 months, I want you to understand that patient, my average patient, may have already had 16 treatments in 2 months, and then they might start to go to weekly treatments. And so they would have another 4, which makes it about 20 treatments in 3 months. And they've been on herbs that entire time. And we've seen a lot of positive changes on blood work tests and then also in tongue and pulses by that point too. So that seems to be the tipping point. Things do go quicker. I've seen things go very fast, and I've seen things take a lot longer than sometimes I've thought. As you get into what you're doing more and more, you'll start to realize that there are just certain conditions and a few people who will take longer than the average patient. But really, honestly, most people do change in about the same amount of time. Energy is energy, and it takes that same thing. It has a lot to do with compliance, diet, lifestyle habits, and things like that, how much stress a person is under, and all of that. And then we have to take into account, obviously, the age of the patient. So this will determine a lot of times the amount and dose of an herb or the herb formula. So generally speaking, I use 3 scoops, and I don't know how many you guys work with Evergreen, but they typically send us with their little scoopers. This is what we give to all of our patients. And when I'm talking about scoops, I am talking about the Evergreen scoop that I get with their formulas. And we usually even have them flat. And for me, clinically speaking, and then cost effectiveness and things like that, I find that 3 scoops twice a day with most of my formulas will work on most patients. And there is more information in that clinical manual that they have. And I think there might be a link at the end of this for you guys. In there on page 13, they get very, very specific about dosing amounts. So I really feel that you can kind of look that up. What these grams, this is about 4 grams, 3 scoops. Okay, just so you know. So they're taking about 8 grams, my average patient. And even, Evergreen suggests that anywhere between 6 to 10 grams daily doses is effective in most conditions, and obviously more or less depending on the size of the patient, the severity of the problem, whether it's acute or chronic. And in some cases, I will use 5 scoops twice a day in very severe conditions. But sometimes the steadiness of an herb might matter, right? Like it might be more important for that person to get 3 times a day to kind of keep pushing that body forward, because herbs are like food and they do get out of our body much quicker, and way quicker than drugs a lot, right? I mean, as a matter of fact, the lifespan of an antidepressant is 3 months in the body. It has a 6-week half-life, and that means it takes about 3 months in total to finally purge completely out of the cell. There's been some drugs, diacylstilbestrol, that was given back in the 60s and 70s to prevent chronic miscarriages in women. It finally got pulled off the market because it was causing so many problems of infertility, uterine cancers, inverted uteruses, and no uteruses, and infertility in the female offspring of this drug, diacylstilbestrol, DES. And they have found that chemical load has stayed in the genetic linkage of 3 generations past the mother who took it. So interesting stuff. Now, we know that not all herbs are safe. I kind of always jokingly say that, like, to dissolve a gallstone, which is actually usually a calcified thing made with calcium, which is very alkaline, you're going to have to use pretty acidic things, pretty acidic herbs. So, if you take those for too long, they can become too acidic in the body, and it is really an acute condition. So, not saying that all things aren't like that, but we do have a nice track history with herbs that have been safe and proven for long periods of time. And they do get out of the body much quicker. They act more like food. So in that case, occasionally the steadiness of the herbs might become more critical than having a bigger gap between the two. I also like to use the herbs more like, you might take your herbs in the morning. Maybe somebody takes their herbs at 8 in the morning. I want the next dose, if they're taking it twice a day, maybe around 2. I don't want them to go to 5 or 7 p.m. It is too far. And I always say that these are functional herbs. So we want them while the body is in function, not at nighttime when it's supposed to be at low function. So let me see here too. I'm just going to make sure. Thank you. And she's sending out some info there too. Great. Excellent. So, and then older patients may need herbs longer than younger patients, but that's not always true. I have found that, when I first started my practice 25 years ago, even children weren't engaged in as many medications. They weren't on as much ADD, ADHD meds, or even now, girls are at the age of 13 are getting put on birth control pills. And I'm seeing girls at 22 now who can't get pregnant. And I've not seen that until the last maybe 7-8 years. And so now I'm finding that a lot of kids, when they used to respond a lot quicker, are not responding as quickly anymore. And it has a lot to do with, I think, the chemical load that they're in, the stresses that we're under, and also vaccinations. And I'm not here to be on a vaccine front in any way, shape, or form. I believe in choices in general. But my point is that the children who have been either maybe damaged by vaccines or overloaded with them, it has compromised their immune system a lot. And in some cases, I've had to tonify children for almost 2 years to get their immune systems back up to not get chronic colds and flus and infections and things like that. So what used to take me 3 months takes me sometimes now 2 years. And that's the only real good explanation that I can find, is that they're on chemical load. I have 3 children myself who I grew up with TCM. They that's all they really know. And they don't get sick. They really don't. I have had, I think, 1 child before I was in TCM school who had an ear infection, and I put him on an antibiotic once, but my kids have never been on them. I've been able to use Chinese herbs throughout the whole process with them. And it's just, and so my point is that it was interesting as they were getting into their teens, they didn't have one friend that wasn't on a pharmaceutical drug. And as we all know, these are pretty addictive, Xanax and Adderall. And I had a child who at the age of 16 still didn't even weigh 95 pounds because he'd been on Adderall and stimulants for over 4 or 5 years. He wasn't growing. So we were able to get him off of some of those meds. And within a year, he grew up to like 3 inches in about a year, and he actually started gaining weight, muscle mass, and things like that. So it's a lot of interesting things that we're being encountered with children. Pharmaceutical advertising started in the US in 2000. So it was interesting as well about probably I'd say 2010, 11 or 12, right around in there. I started getting the kids who grew up on pharmaceutical advertising, and it was very interesting to see them with their parents that I may have treated previously, who are looking for alternative choices. And I had several patients or kids say to me, can't I just take a medication for that? So it's interesting to see the psyche of the patient over time. Interesting stuff, but it's stuff that you have to consider. So these are very important questions to find out when you're working with children as well. Is, have they had all their childhood vaccines? Has there ever been any reactions to them? Just due diligence. And that's with any kind of medication in general. We have to know what they've been exposed to, a good full health history, compliance, even if they've had maybe birthing traumas and things like that. And then children, they are a little trickier, but I find that they will, if you communicate with the kids a lot and you let them taste it and you have them involved in their care, they're more likely to use, the granules. So I don't sway away from them, but if I have an easier way to comply, or if it's not as complicated as a case, I might use other things, including homeopathics, which I find can be helpful in kids that are younger because they dissolve very quickly under the tongue and they don't require trying to swallow, which can be hard. But there's a lot of pediatric formulas. And as I was sort of saying in here too, a lot of them, I just have them add a little honey, which makes it a little bit sweeter. And we know that honey has nice healing properties and good for the immune system too. And if it's for allergies or anything like that for children, then local honey is better. So you guys may have heard about that, that local honey picks up the pollens around the area, and it does make you kind of have a homeopathic dosing amount to the allergens that might be more in the localized area. And in some cases, if they really need these and they're having a hard time swallowing the taste of them, then sometimes I just take the powder and roll it into a little bit of a honey paste and make it more like almost like not a tablet, but a little bit like a tablet, and then have them just take that, and they do usually pretty well. So don't shy away from it. Kids respond really well, really most of the time. They respond fast and quick and have much better compliance, and they're a joy to work with. They're a lot of fun, and typically under 10 years old, often just 1 scoop twice a day has had good clinical outcomes. All right, so we're going into Western medical diagnostics and tests. These, again, are all things that I consider when I'm using and choosing the right collection formula for my patient. I definitely like to confirm the Western diagnosis. I really do want to know what they are saying, even though they're diagnosing in symptoms. If they're being diagnosed with RA or autoimmune dysfunctions and lupus and Crohn's disease, I want to see that test that prove that. Because I've seen so many patients walk in my door diagnosed with rheumatoid arthritis and other autoimmune dysfunctions and diseases, and nothing shows up on the test. So it's just that they've gotten so far advanced in their condition that the doctors have no other explanation to call it that in general, because remember, they have to be able to give a diagnostics in general, because if not, you wouldn't be supported by your insurance. So no matter what, they're going to get to the closest diagnosis that they can. But if they don't show these things being out of range, the ones that we put on like your lab tests, like SED factors, IG numbers, RA numbers, ANA numbers, things like this. And even ANA numbers aren't extremely accurate. I mean, if you even Google Mayo Clinic and see that they say that something like 80% of people can come back positive ANAs with no other autoimmune dysfunction. So you can't just rely on that. We can't just rely on tests in general either. Most people don't understand that ultrasounds are only 30% effective. Treadmill tests only pick up a 70% or greater blockage, things like that. So I had a patient who had over 100 stones in her gallbladder. And when she came to me, she had been a previous client who actually helped and fixed her health conditions. But when she finally came back to me, she had been under a lot of stress for years. With her parents, and she wasn't taking good care of herself. She wasn't eating well. She was overly stressed, not drinking enough water, all those things. And then came back to me in a crisis. I mean, she had lost something like 40 pounds. She was down to 98 pounds. She couldn't eat. And, I did my diagnostics and I'm like, I think you have gallstones. If anything, it's a gallbladder problem. So I put her on Dissolve GS and we started that path. And 2 weeks later, she still wasn't doing well. Her pain was subsiding. We were getting better results there, but she still couldn't eat. When she came in too that day, she came in and she had already had an MRI and they said that she had no stones. Okay. So, I want to take that into consideration. Okay, great. So there's no stones, maybe they're sludge, maybe it didn't show up. But I still, through my diagnostics, tongue and pulse, still felt it was a gallbladder problem. And I did still feel that there might've been an accumulation. So I did put her on the Dissolve GS and we went about 2 weeks. We were getting her pain down. She was feeling better, but she still couldn't eat and she was still losing weight. And so she went in for another MRI because she's working kind of Eastern and Western at this point, because it really was a crisis. It was almost becoming outside of my scope of practice, kind of almost into an emergency. So they did another MRI. It didn't show anything in that gallbladder, and they told her she had pancreatitis. So I'm like, okay, interesting. I'm gonna take that information and I'm gonna kind of challenge my thinking and my theories and my overall observation and diagnostics and my experience and say, well, pancreatitis and gallbladder, they can act very similarly. They act together a lot. They're often part of the same problem. So I did switch her. I don't remember at this point what I switched her to, but it was a pancreatic formula a little bit more. I thought, all right, we'll go with more inflammation in the pancreas. I don't remember what formula I used at that time. I'm sorry. But I still was like, no, Anne, I think this is literally still your gallbladder though. So I was treating her with needles as if it was still a gallbladder problem. But her herbs I switched and she didn't do better. And so over the course of time, because she was coming in twice a week at least right then, trying to get her pain down. And I'm like, I don't think this is the right formula. I'm going back to the Ledonpion. I call it Ledonpion, is what comes out of my mouth faster. Ledonpion is the equivalent to kind of the Dissolve GS. They're sort of synonymous of the classic formula. But I was using the Dissolve GS and we put her back on it and she was doing better and better again. And 4 weeks went by. So this was in a whole 6 week period, right? Had the MRI, 2 weeks later, did another one. Both of them showed nothing. I changed really quickly, but then I changed back and went back to the formulas that I believed were better for her and correct and more accurate with my diagnostics. And I kept telling her, I really still think it's your gallbladder. I think you need to do something. And she's still losing weight. So it was a problem. So she went up to Northwestern in Chicago. They did one more MRI and they're like, oh my God, you have stones in that gallbladder and we need to remove it right away. I hope at this break I could find it and show you it. I have a picture of that gallbladder. It had over 100 stones in that gallbladder. Okay. She couldn't have developed those in 6 weeks. It wasn't what happened. They had been there the whole time. And that's really when I found out for the first time in my entire practice that MRIs are only 30% effective. So they're a great diagnostic tool. Blood work is very helpful. We will not ignore it. It's very important to overall understand the whole concepts from what they're diagnosing to what the tests have come back to what you see. But honestly, TCM diagnosis is really accurate, and you should trust your diagnostics. but I always, always, always encourage more information, more knowledge, more challenge to my thinking so that I can make sure that I'm doing the very best for my patients. So it's very important to look at those, but don't just judge everything on it and follow your course of action, because most of the time it's probably pretty accurate. So that's an important thing. But the other part of that is I've had a lot of patients who actually have had RA numbers high, IgG numbers high, and they would have been considered a classic rheumatoid arthritic condition. But I have probably say 80% of my patients who've even had quantifiable diagnostic autoimmune dysfunction have actually been able to reverse that condition through acupuncture and herbs. So the doctors have had to come back and tell them that, oh, I guess we can't say you have RA anymore, or, you know, whatever the condition might be in that lupus or whatever. So that's interesting to me. I find that to be pretty fascinating. So I don't just also go, geez, that's a death sentence, or it might take longer than you think. It's just that the body may have broken down so bad that the whole immune system has gone haywire, crazy, and the numbers are out. They're out of range. But it doesn't necessarily mean it was a true Jing problem. It doesn't mean it was genetically driven. It could definitely be still driven by diet and lifestyle alone, and with a predispensity towards going into that realm of inflammation. So that's an interesting part. So medications, the amount and type of medication the patient is on is also very important for your diagnostics and what you're going to choose in your medications. Treating the underlying TCM diagnostics. I have to move something because I can't see my slide. Sorry, guys. Let me see if I can move that a little bit. Yeah, a little bit there. CCM for balancing the body, but avoid known similar herbs to the med. So in that case, if somebody is on a blood pressure med, I may not use like with the classic collections formulas that Evergreen has, like Gentiana or Gastrodia, until I'm trying to reduce that medication. So I might be going after the kidney yang deficiency and the dampness with the underlying herbs, which then, even though they treat that, right? Like they do treat that condition. If you look at these indications for something like, you know, kidney yang tonic, or even in the classics of patents, they would be like Jingwei Shenxiwan or something. It does treat hypertension and, you know, thyroid dysfunctions and even diabetic conditions, but it's not its major function. Its major function is to tonify the kidney systems. So that happens even with acupuncture, right? You can calm the nervous system down. You can treat blood pressure that way. You can deal with the nervousness there. So it's not that we don't do some of those points. It's just that I won't start to use herbs like that until I absolutely need to, and start to have what I kind of consider more of the symptom treatment of it, but it's not, because obviously like even Gastrodia gets to damp heat, right? Which is an underlying condition for hypertension as well. But it does have a little bit more direct impact on trying to reduce the blood pressure. So what I typically find again is that we'll start to see deficiencies change within 2 to 3 months. So that's when I'll start to use maybe the reduction of meds. Again, I won't take people off of meds just to take them off the meds. We fix their problems and it starts to naturally happen. We have to be skilled in those processes, but not everybody might work in the way that like we do in our clinic. Maybe they don't want to be involved in that, but we will only help patients who want to find either alternative approaches. They don't want on those things maybe anymore. They want to fix their underlying condition and understand it might change. So for example, also I had an older woman who was probably 75 years old, and she was coming into me for pain, and she was actually responding pretty well, even without doing too much in terms of underlying deficiencies yet. She was responding really well to acupuncture, and she wanted to do some care for her pain, but she did not want to really fix the underlying pattern. That to me makes her condition more stable longer. If you fix the pattern, then the symptom stays away for much longer, like years and years. But if you don't, then we're managing symptoms still a lot. So she didn't want me to do that. She didn't want me to put her on any known herbs that would help her to reduce her blood pressure. I didn't go into telling her that acupuncture alone could do that. But you know, it can, right? I didn't do like LI11 and stomach 36, which we classically know can help bring down blood pressure, or ear points that are known to bring down blood pressure. I stayed with the underlying condition. I treated the pain, and she was on 3 blood pressure meds. She was averaging about 120/80 most days. And I'd say within 4 weeks, her blood pressure was coming down to like 96/60. And and I didn't catch this right away, but she started to tell me she's super fatigued. She kind of feels run down, blah, blah, blah. So we start investigating, was she eating differently? Was maybe the herbs, something I was doing there, if I needed to look at that, what causing her fatigue, was it stress? And then I came to check, well, let's check your blood pressure. And it was down to, like I said, 96/60. I'm like, oh man, we're going to have to do something about your herbs at this point, because when your body starts working better, guys, your body filters things better, it'll metabolize things quicker, and the drugs can actually become stronger. Okay. So it was making her blood pressure come down too low. We had to discuss it. I did send her back to her doctor because that's not what she was there for with me. And we discussed that, and she had to reduce and remove one of the 3 meds that she was on. And I wasn't trying to reduce her blood pressure with herbs or anything like that at all. So interesting stuff. But once we start getting to the point where we're reducing those medications and coming off of things like maybe an ADD medication and things like that, then I might be more addressing the actual symptom of it with some of the herbs that are known to kind of even create more acute or symptomatic changes faster. Okay. All right. So let's see here. Let's get here. Understanding herb and drug interactions, right? So I really feel that it's more of my ethical responsibility to keep up on continuing ed in herb drug interactions. That's really why I'm with EV Herbs mostly. They're one of the best places I've ever found to learn the most about herb drug interactions, but I truly am the one who's introducing those things into their life, not the other way around. So I do feel it's my ethical responsibility to have a pretty good understanding of meds in general, what they are, what kind of herb drug interactions there can be, avoiding obviously known blood thinners if they're on blood thinners, knowing which herbs and herb formulas do that. And there's a lot of information with Lotus and Evergreen so that you can really do a good, thorough job, even if you're a young practitioner, in avoiding those types of things. And then sometimes if they're like, I've had patients who come to me and like, I stopped my blood thinners because they're hurting me and I keep breaking out with these bruises and I don't ever want to take it again. And there's a reason that they put them on that though, right? I mean, there's sometimes a reason that they're putting this person on a blood thinner. So if you do have to mimic that in some cases, then you can definitely use things like I put up on the screen, like vitamin C and EFAs actually have a blood thinning potential to them. Aspirin does as well. And so does things like ginkgo biloba. I know we don't use that very clinically in Chinese medicine, although it is used. It's just not used as a blood thinner. It was used as a lung tonifier, right? For lung dysfunctions. So it slightly thins the blood, which helps us to get more oxygen to the lungs, which can actually stop coughing and things like that. And that's why, that's what we usually use it for. And I try to use my herbs classically. Okay. I don't usually try to use them like with modern research necessarily, because it does change the clinical outcome. And we don't have the same history of maybe 1,000 years of using that formula. But if I have to use it to do something that they were doing to mimic that, then it is also important to slightly understand that. But a lot of people have said to me, well, why aren't you using like standardized extracts? Okay, that's an interesting thing. Why aren't we using a standardized extract? Well, if you understand standardized extracts, what they did is they're taking out the ginkgo sides and they're pulling it out of the ginkgo, and they're making sure that there's exactly 500 milligrams of that one thing. Well, that is going to make that one thing stronger now. So that outcome of that, based off if you used it in the classic way in the herbal formula, less likely to cause too much thinning. But when you start to get to standardized extracts, you're starting to turn that thing more into a drug. Okay. And so now you actually have to be very careful when you're using them. And we also don't have the historical data on long-term clinical outcomes with them. So I prefer staying with TCM formulas, long-term usages. Not that I won't use modern research, definitely important. But I really like to have the backing of 1,000 years of clinical outcomes, and I try to use them still that way the majority of the time. And I do most of the time won't use a lot of standardized extracts. That's just me. So, and then removing a medication that's effective, like I said, you might want to look for that thing. You might need to have something happen like that. Like when I'm getting somebody off of Xanax, sometimes I'll use the Calm ZZZ, but I also might even use something like skullcap, which is a Western herb but man, it works effectively. And also even green tea produces GABA in your brain, which is what Xanax does. So if we can get people on green tea, we can also help them to produce a little bit more GABA so that they're not having this big crash coming off of these types of medications. The other things to consider is what the patient is doing. The worse the diet and lifestyle are of the patient, the more and more intensified the herbs need to be, or maybe the longevity of them, or it's going to take slower or longer. It's very important to always discuss the diet with them, making sure that they're not doing too many weird things that might kind of counter what you're trying to do. Like, for instance, that we do know that dairy is known to produce mucus. I mean, that's one of its properties, is actually to produce mucus. It's also a growth factor for babies, right? So it actually is an endocrine developer, and with things like human chorionic growth hormones. Growth, yeah, like it has growth factors in there. I can't think of the name right now. But so dairy does have this natural growth thing, and they often use it in severely debilitated, emaciated, and yin deficient conditions, but it does produce mucus. So if the patient's coming to us for chronic sinus problems, congestion, and all of that, and we don't discuss dairy with them, we're just contributing to dampness on a daily basis and trying to get rid of it with herbs. Sometimes it doesn't even really work. On that note, though, with this is very interesting. People have come to me for weight loss, and I used to, go after the pattern, to do, the damp clears, the spleen tonifications, whatever we have to do. Maybe it's kidney yang deficiency, thyroid's out, something like that. And I found that I didn't have as much clinical success until I started adding circulation herbs in there, which is very interesting. So herbs that move the blood, like circulation, which is the collections formula, or in the patents, it's Shui Fu Zhu Yuan. But when I started adding a blood mover, it mimicked exercise, and it went and moved the blood around the body more. And actually, I feel help the body pick up dampness better, clear it, and move it out of the body. So that was a very interesting thing. And they don't often have blood stagnation showing up on the tongue in this condition, but the dampness in and of itself is creating blood stagnation, even if it doesn't show up on the tongue. And so when I started adding circulation formulas to sort of mimic exercise, especially if the patient can't move because they're in pain, then I had more clinical success with getting rid of dampness. So that was an interesting find. And stress is also a conditioned response. So, we can continue to de-stress our patients through acupuncture and herbs, but overall, our job is to teach. That's what the definition of a doctor really is teacher. And so if we don't educate our patients on that stress is innate, right? Because survival is, I'm gonna, I got to survive. That is innate. We build very strong chemicals, adrenaline and norepinephrine and cortisol and higher levels of testosterone and estrogen and progesterone. And we don't teach them that calmness is a practiced art. Then we really are doing disservice to them, because that is a really daily practice, or maybe even weekly practice, that we need to do to counter the stresses that we can never remove from somebody's life, right? So don't forget about those other 8 modalities out there that actually help our patients get better. You don't always have to go after herbal sources or acupuncture sources. I do also use ear tax a lot in stress conditions and things like that. That helps. I may help to teach my clients how to use them so that they have another tool at home. But I really believe it's important to help our patients practice the art of calmness. And again, when we're in our parasympathetic nerve system, out of the fight or flight responses, that's where we're making normal fertility hormones. And again, fertility is 30% due to stress, because we're putting up testosterone levels at superhuman rates. And that 85% of the serotonin is made in our small intestine, right? So if we're not calm, we can't make serotonin. It's actually calmness that helps our body to produce it. So these are very important things to help our clients understand for our overall clinical success, and even having our herbs work better. Dosing amounts, 20, again, at first I might not use 200 gram formulas, But once I know what I'm doing and I have a pretty good solid pattern, most conditions could be responsive to at least a month worth of herbs, that I won't maybe change that herb formula right away. So usually I'll make a 200-gram formula, and we'll use 3 scoops twice a day with most patients, which we talked about is about 8 grams of dosing in a day. So 4 grams twice a day. And I have very good clinical success. It lasts about a whole month for them. And if I do have problems with my underlying, formula, and I need to use something like the Magnolia Clear Science or the Pereira Clear Sinus, then I can always give them to do that on the side as well. Like I can either have them add a little extra into the formula that they're already taking, or I can give that a little bit on the side to treat that condition a little bit more frequently throughout the day. Because sometimes with allergies, I may want them to do 2 scoops 4 times a day to help the symptom of it more, as I'm still treating the root of the problem with maybe a little bit of that in there. But if they don't have many symptoms and I'm also using acupuncture and I'm getting their diet to change and they may be on vitamin C, which helps their immune system and also thickness of the phlegm, then I don't over address the symptom unless I have to, because the symptom's there. Then I can actually use that a little bit on the side, and it really makes it easy for me to do that with powdered granules. It's very effective. Again, that is on page 13, the dosing amounts of things. So you can look at that again. In acute conditions like a wind cold or a wind heat or something, sometimes 50 to 100 grams is often enough to give to a patient. Sometimes those only last, the condition only lasts about 3 days. So, they might only need 50 grams. But in typical, they wouldn't often need more than 100 grams in like a wind cold or a wind heat formula. Or what I'm trying to think, what else that might be acute. Sometimes a gout, or in terms of shingles, so those can often be under 100 grams and have good success without anything more than that. So those are kind of common for me. And then remembering that, you want to look at the percentage of the formula that you're used based on the chief complaint. So I'm going to get the biggest underlying pattern, and I want to address that the most clearly, which I would call my I can't think of the name today. The primary driven formula. I might have around 50 grams, maybe 40, maybe 60. It sort of depends on the severity of the problem. And then I'm going to look at the secondary complaint with about maybe 40 grams of that. Then I'm getting into 20 to 30 grams of some secondary and tertiary complaints. And then maybe I might have 10 to 20 grams of supporting herbs to make up that 200-gram formula. Okay. So people, I think I was a little hesitant to use formulas until I've actually done more studies with Evergreen and with other practitioners at Lotus and things like that. And that is that they do often use formulas. And I was a little hesitant at first because I was like, wow, wouldn't it be better to just use the individual herb and then make up the formulas? But the truth is, I think that the formulas are clinically easier, very successful, and pattern driven that lead to really great success. And I think my biggest concern at first was, oh my gosh, well, what if I give them too much Dongui or something like that, right? Because Free and Easy Wanderer has it in it. So does Women's Precious Tea Pills, Bazingson. So I thought at first that was like maybe a concern, but if you have your percentages and ratios correct, and what might be in there that you think may be not great for the patient, like if there was too much cinnamon or something that may be too warming in a couple of the formulas that you picked, you got to consider what and where you're picking that formula from. Maybe you don't need the secondary formula. Maybe you just need more of the primary formula. But I thought at first that would be a little bit of a hindrance, but truthfully, it isn't. It's very clinically successful, and I really like using it. You just have to kind of remember your percentages or ratios, and that you may be overlapping on a few of the herbs, but not all of them. So keep that in mind, and you'll do very, very well with even combining those 2 herb formulas or 3 or 4. So I think we're at about, we've got a little bit more time. So we will start to, are there any questions that anybody has right now on the information that we just discussed? Okay. We're probably going to be taking a break in just about maybe 10 minutes or so. Remember that there is the chat room to go into if you want to, and I don't know if I can hear people or not. Who can see? Okay, so I did get a question. It says, how many herbs do you use in one formula? That literally depends on the patient, but I would say on average, I am probably using 4 to 6 standard formulas like I'm just going to use the classics real quickly, like Tianwang Bujindan, maybe with Jingui Shenqi Wan, with Xiao Yao Wan, and maybe I need something to move some blood or something like that. So I would say 4 to 6 is not uncommon for me to use, but I have had some very, very complex cases where I've needed even six different formulas to kind of make up the combination. And I don't chase every symptom either. I mean, I don't chase every symptom and I don't chase every tongue and pulse, but it's the complexity of it, right? Like if the kidney systems are very, very weak, leading to, remember, your kidneys control the bones and marrow, reproductive and endocrine function, right? So a person with kidney yang deficiency could be diabetic, have hypothyroidism, and also have hypertension, right? So I've got 3 very unique and very specific things that may not be addressed very well with one classic thing. Although again, the kidney yang tonic or the equivalency of Jingui Shenqi Wan may still treat all 3 of them. What I found with the collection formulas by using the things that we're going to be going into talking about here pretty soon, like that's on your screen right now, the equilibrium with some of the thyroforte, with your kidney DTX formula and some circulation, I'm going to get better clinical outcomes quicker on that symptom of quantification. So I will see the numbers change faster than only using like the kidney yang tonifier or only the one single thing. So that's what we do here. Probably about 4 to 6 is pretty common for most of my clients. And then the other thing about that, since before, because I kind of want to break when we get here a break, and then we'll go into all this because I think it'll be a nice break. So I'm going to just talk to you about a couple of clinical things. We probably have about 1, 2, 3, 4, 5 rows of, I probably have about 120 formulas on hand. I didn't start like that. I started with the basics, the most commonly seen patterns in my clinic, the ones I was most interested in, the ones I was most clinically successful with, and I started to build my herb pharmacy from there. But I run about probably 120 herbal formulas on hand. I do have some raw formulas. And then again, everything is about communication. So there's a lot of information patients get when they come to TCM doctors, new information, things they've never heard, herbs and drugs. Oh my God, are these okay? That's scary. Needles are scary, right? So whatever we can do to mitigate communication errors or problems is always an important thing. So a lot of stuff that we have is already pre-written down, pre-made, and at our disposal. Even ear tack information, like I'll tell them, you can go home with these, leave them in for 4 or 5 days, blah, blah, blah. But I send them home with the information too. Okay, because people can only hear certain things, lots of information, they might miss something. I really want them to be I want them to be successful with the things that they have to do in their life. I don't want them going home struggling about, what did she say? I don't remember. What's that going to do? Cause more stress. So, we have like prescription pads that we create. And that we write down. We also have how to take your herbs written down so that when they go home and they can read through that again. But I always do still like to communicate with my patients what I expect, what to expect, what's going to happen, or any concerns like, yeah, get those ear tacks out within 5 days. I don't want them actually, having a problem with them, by staying in long and then causing an infection, or in this case, herbs and drugs, right? Like we don't want them to take them together at the same time. So I will tell them, because it's important that I've explained that to them, and it allows the client to be able to communicate any concerns with me first, than to just give them the paper and leave them to go. And then you don't know maybe what their concerns are. But always, whatever you can address, correctly and efficiently is always in your best interest, because a lot of times, most of the time I have found that what I have to do is establish trust with my patients, right? I'm the one who's introducing new and weird things with them, or it's foreign and unknown. And if it was so good, then why doesn't everybody use it? Or why didn't my doctor? Now we know that doctors in Western medicine are getting way more on board with what we do, but it's still a trust issue. I mean, I've had patients who completely trust their doctor, who nick their nerve and they can't walk anymore and still go to them. And we as Western or Eastern doctors sometimes have a little bit of an issue with that. So everything I do is about establishing trust. So whenever you have known expectations like, wow, we're going to give you Wang Lian today, and it's going to cause you to be having slightly loose stools, this is normal and expected, right? The interesting thing about Wang Lian, right? Like, so if we have all this phlegm stuck in our lungs, you know how much energy it takes to even cough that all up, right? Oh my God, it takes a lot of energy and it hurts. And sometimes it even sore and our ribs get sore. Wang Lian is such a beautiful formula because it helps to push that phlegm down and through the digestive tract and out the body that way, which actually saves the patient from actually it all coming up and out of the body. And that does happen while we're healing, that the phlegm, as somebody's getting better, the phlegm, if it's doing the right things, it will try to start to make its way up and out the nose. So the end stage of a wind cold sometimes is the last thing, is that the fluids are coming out there. And sometimes patients think like, I'm getting sicker. We're like, no, that's actually better. It's coming up and out, and your body's actually in the final stage. It's not here anymore. It's just coming up and out the body, because where is it going to go? It has to come out. But that's why I love like Wang Lian, truly, because it helps to force it down and out. But they think maybe they could think that that's a side effect or an unwanted response. So if I don't let them know that you could possibly have loose stools from using this formula, then I'm going to lose clout, or they might stop it and they might not use it in the right way. So whenever you can help those patients understand the expectations on what's going to happen, it's a lot better. So one other quick example on communications is just that I find that on the second and third treatment in a row, so I've had a patient, the first treatment in, we needle them, half of them don't even feel the needles going in. And I'm a free-handed needler. I don't use insertion tubes. And they don't feel them, right? But the second and third, I'd say 80% of my patients over the period of my career will say, oh, wow, gee, Laura, I feel them all going in. Why do I feel them all more today? And, I don't really have a great explanation scientifically, but I do believe that their body is so deficient the first treatment that we sort of stimulate that healing potential, and then they feel them more, and then it sort of slides down again, and then it kind of starts to inch its way back up. I think there's a big swing that happens in those first few treatments. So I explain to every patient on my second and third treatment, I will tell them that it's 80% likely that they're going to feel more needles on the second and third treatment than any other treatment. Although, things like stress, caffeine, and dehydration will also make the patients have more sensitivities those days. But I explained this to them on the second and third because it's harder to go back. Like if you needle them and they're all like, oh my God, they all hurt. Why do they all hurt? And you knew it. And then you say, oh yeah, that's normal. Yeah, that happens. Then why wouldn't I have told them that to begin with? Right? Because it gives me better clout. It's more forthcoming, it's more accurate, and it's truthful, and I have nothing to hide. That is part of the reactions to what can happen. And if I know it's possibly going to happen, it's better for me to say that it might be this way. That's not an unexpected or unwanted effect. Some people never have that happen, and some people it could happen on the 10th treatment. Is much better for me and helps me to establish trust in my relationships with my patients. And I will even tell them things like, I don't know the answer to that. And that is, I will look into it though, because I'm a person of truth and seeking knowledge. Every bit of information always helps me to challenge my own thinking and make sure I'm doing the best and accurate conditions. I'm not afraid of not knowing something, and you should never be. I think it's a disservice to clients if you don't sometimes say, I really don't know that, but I'm going to find that out. And at this point right now, I'm going to say, don't do something if I don't know. But there's no harm in being honest and real with your patients. Not scary, but real and honest with them. It helps you to establish a better relationship. And on that same note, I do work with associates. I have in 25 years, I've had about 18 years with another Chinese medical doctor with me. so the other part of that is if I needled them the first treatment and then the acupuncturist needles, the other doctor needles them on the second treatment and doesn't say that to them, they might associate no pain with me and pain with them, and then not be as likely to want to work with them. And in our clinic, we're not practitioner specific. We work together as a group, and I might needle one day and they might needle one day, and I do exams, things like that. We'll switch it out a little bit, but I don't want somebody completely reliant on me because TCM works, right? It's not me. I want to be a good doctor. I want to be able to impart good treatments, but TCM works if it's delivered correctly by anyone. So what we want is to make sure that people understand that it's Chinese medicine that works, not necessarily the practitioner. In some cases, I will honor the respect of a patient, if they really only want me but we're going to start to ask, well, did something happen with your other doctor? Did we have any concerns? And I also want to be able to leave or go on vacation or, deal with my aging parent or something on occasion. So I don't want my patients to be thinking that I'm the only one who can deliver successful treatments. So that's why we communicate everything here, maybe too much communications, probably TMI, but very necessary and important things for good clinical success and trust within your office or within your practitioners. So we're about at the time to take a little bit of a break. And when we come back, we are going to be going over many of the herbs that we have on the board. These won't really take tons of time. There's a lot of information on them. So I really want to try to impart some of my clinical experiences. So please think about any questions that you guys might have. Try to throw them out onto the screen. I could probably review them over the next 10 minutes while we're on a break. 10 to 15 minutes. I think we're giving it. So we'll give it 15 exactly when we head out, and Donna might help us with that in a little minute. But if there are, please send them out, because then I can read through those and I can start to kind of think about that clinically and really address any concerns. Because I always feel that it's better to address your questions than to just only impart information. So I would really like to make sure that I am addressing any of the people on the internet today with us, the students or whatever, I don't know, participants, that's the word I'm looking for. Well, we can, because I think it's important. I really want to help that if I can. So with that being said, I think I will pass this off to maybe Donna. I think we're good to go. So I'm going to say we'll be back on at no later than 15 minutes from now. So sound good? Excellent. We'll see you guys back here in 15 minutes.
You did great. We'll come back at 11:42 p.m.
Thank you. Okay. Sorry, guys. I got to find my thing again. Let's see. That's hers. How do I get mine back? Sorry, guys. Hold on. Me and my clinical challenges. All right. Share the screen. Here we go. I think this is it right here. Okay. All right. Welcome back, everybody. I hope you had a good quick break. And I did get a couple quick questions coming through. Some of them I've just actually. Okay. Yes. Somebody just texted about my lecture notes. They should be able to get this PowerPoint now. I just sent it off. So that is going to be available, I think, to everybody here pretty soon. So thank you for asking about that. The other question is that somebody asked, and I think this is a really good question. And unfortunately, I don't think I have a great answer for it, but somebody had asked, how many herbs are too many? And I actually have to tell you, I don't think there's necessarily a limit to that. There are some classic formulas that have 30 herbs in them. And obviously when I'm using these in combination, I have literally probably had 60 individually and unique different herbs within the same formula. So And I haven't had it be clinically problematic. I haven't had the body respond negatively. I haven't had the patients not be able to tolerate those. And those are some things that at first I did have the same concerns, like, oh my God, that seems like a lot. Or, sometimes you hear you're going to confuse the body. But I really don't find that to be true when you have a very, very good, strong diagnostics and you really do know your TCM. I'm not going to use 4 or 5 formulas if I only need one, right? So that is the other part of that. But in most cases, honestly, and I don't know, I jokingly say I specialize in difficult cases because I get a lot of difficult cases and all that kind of stuff. So I really often have to use, so somebody was asking about that. I've often had to use, more than that, because I have very complicated combinations of formulas, but I typically really won't use more than 4 to 6 on average. Again, maybe 5 different formulas. I also have to, again, consider how many are in there, how much isn't, because something like Free and Easy Wonder or Jayawan only has like, I think 6 herbs in it as a total, Siwuwan only has 4, right? So it sort of depends. And then like Duho Jishengwan, Solitary Hermit, which I often use in place, or like here, we often use the Back Support HD or something like that. They have something like 30 herbs in it. So I really think that sometimes we have to look at what's historically been done. Not just rely on some of the things that we do just learn technically, right? Because in technical studies, it doesn't always come down to the clinical studies of that. And if they've used something like, let me see too, I want to look at Duho Jishengwan that has something close to 20 something herbs, and they've used that historically for a while, maybe there isn't really any clinical significance to only using 10 herbs individually on there. Or one of the other things I hear a lot is like I've had practitioners say, well, in school, don't use more than 12 needles. Don't use any more than 12 needles on a person. Okay, so you need Li4 and liver 3 to move stagnation. That's already 4 needles. And then, they've got hypertension. So we'll just throw in like Li11 and stomach 36. So now we've got 6 more, we're at 10. And then they've got kidney weakness. So we're at 12. We got to stop there. I mean, when they got digestive issues, they still have pain. My experience when I went to the University of Guangzhou in Southern China is that I often saw that they had 30 needles in just a leg treating a knee condition. So I don't know. I think it all comes down to what's historically been done. If you look at classically how much or how little they're using, it's usually that in America, we seem to be watering it down to some degree, or we get into different styles. And there's nothing wrong with those types of styles, like, Tan style that might use less, or you might use 1 needle, and sometimes in Japanese style needling, and superficial versus deep, and where do we go? And so when I answer these types of questions, I often think it comes down to the practitioner and what is your goal? Are you more interested in herbs? Are you more interested in Tan style and getting good at that? I do and have seen practitioners in my career that we kind of, the jack of all trades, master of none. We are better sometimes to stick with that realm that we think we're good at and work with that than sometimes to sway away from it. So I am particularly not a Tong style needler or a Japanese needler. I don't prefer using sarins. I think my clients can take regular, needles, regular Chinese style needling. I don't think it confuses the body to have 35 needles in there, sometimes 40. So I guess my point here is for one of our panelists is, I think clinically it comes down to your comfortability level, your ability to understand what you're doing, your ability to understand how they might work together or not work together, and not swaying outside of that realm. Again, when you're starting something new, the more that you can do with other practitioners and learning that is very helpful. But in those cases, remember, I even started with using 1 formula. one formula at first. Let me just kind of understand how free and easy wanderer works, Jiayawan, so that I can understand that and not get too complicated, right? So my ability to get to where I'm at and being able to feel that I can combine the herbs together safely and effectively also has to do with the length of time I've been doing them, how I've seen my clinical outcomes, and all of that stuff. So I just don't want people stuck that you have to be one way or the other. I think they're all effective. It's kind of like temperature. The swing is there, and it really comes down to your ability to function at that level. And when I do say that the master of none, sometimes we could kind of think like, well, then should I just specialize in acupuncture? Maybe. If you don't feel very comfortable at all and have absolutely no interest in herbs, then yeah, you really probably should focus on it. But Chinese medicine is a complete medical system that does incorporate multiple facets, right? We're not just the nutritionist, we're not just the herbalist, we're not just the acupuncturist. We have all of those at our disposal. Now, I don't use Tui Na personally in the sense of like delivering it. I don't do Tui Na myself. But I have massage therapists in my clinic who do. All right. If I wanted to do corrective structural integration, I do believe that I'm going to give exercises. I'm going to use those. But in some cases, I'm like, go to your physical therapist, go to your chiropractor for that. Right. Because I'm not that skilled in bone manipulation. I might set a ankle. I might pop in a wrist, things like that. Or even sometimes I won't just never use Tui Na, don't get me wrong. But when I can have somebody who actually is skilled at that more effectively and more consistently, plus they can't needle people, then I'm going to send them into those realms. But I feel very comfortable in general with using almost all aspects of traditional Chinese medicine, 8 modalities. Feng Shui is probably the least used modality overall, but understanding that your environment can actually cause disease or imbalance is an important thing. But I will tell you, it's interesting, I'm kind of going off on the side for a second, but the Chinese said that the wind is the mother of 1,000 diseases. And you listen to that and you understand that and you go, okay, that's interesting. And it does incorporate wind, cold, wind, heat, right? That's infectious diseases. Yeah, there's probably thousands of them. Well, I don't know how much of you guys, I'm not an astrologist, but I have to pay attention to this because clinically, I will have people roller coaster in their symptoms based on the weather. Now, I live in the Chicagoland area where the wind and damp are severe. It's probably the worst in the entire country. We have the 2 Atlantic and Pacific weather patterns clash right here in what they kind of call Tornado Alley. And then all the wind blows up and then blows right down Lake Michigan, all this dampness. So remembering that damp cold is worse than just cold or wind chill, right? Or damp humidity is worse than just heat, right? And so we don't put a lot of credibility into wind and damp environmentally because we don't often see it. But when I was early in my career, spring and fall would come and people's symptoms that were at bay were completely exaggerated. Or I would see commonly, oh, I can't sleep. I'm restless. I can't sleep. I'm insomnia and I'm feeling headaches because the wind is driving up the yang to the head. And you'll see everybody on the floor having the same 3 symptoms. And we're talking about 40 people in the same day. So you're starting to go like, okay, so you can't be your food you ate. It can't be just the stress you're under because it's happening to all of these people who aren't even related to each other. So I used to have to put up I'd put up spring and fall communications, I called them, right? So what to expect in spring and what to expect in fall. And I would put this up on the wall so that people could understand what types of conditions we might see from the wind. But what happened in 2020 is we had a 6,500-year comet come and enter our atmosphere in July of 2020. And that very week when that comet hit the atmosphere and broke through our atmosphere, that same week I had several patients have epilepsy, seizures, going into cardiovascular events. and then also dogs going into this too, seizures, epilepsy, things like this, when it broke the atmosphere. So we've been in a 5-year unrelenting wind pattern. And in the Midwest, it's been very, very bad, where we went from February to June with no winds lower than 20 miles an hour for over only 4 days out of that whole entire time. And so I've gotten to see, and now there is research that proves that 70% of all cardiovascular events happen around microcurrent storms. And I got to see what they really mean, because electrics will short circuit your electrical systems. Your heart emits more electromagnetic energy than your brain. So people can get into seizures, strokes, comas, fainting, heart palpitations, heart attacks, high blood pressure, strokes, all more around the wind. And so now I truly, truly understand, because it can also stop water. So then there can be more pain and more arthritis and people having loose stools that never had them, and then digestive dysfunction, and it aggravates the nervous system. So heightened anxiety. I really, truly get what they mean by that the wind is the mother of 1,000 diseases. It truly is. And it's not just infectious diseases. So those are just some interesting things. I had to put up communications that said weather affects our health. And it can, because it can happen on any given day. And so I also say to clients, like, because they don't understand wind and damp. I don't know if we do very well either, because you can't see it. So 2 things I do express is that, so when the supercharge of the atmosphere electrically is aggravating us, it's sort of like we touched an electrical fence, except we don't see it happening, but our body is still responding to it, but not the brain. The brain wasn't stressed. It is a distress signal to find shelter, I believe, okay, as our bodies get a little anxious. They found that during barometric pressure changes, that our theta waves will increase, which causes increased drowsiness, and our alpha waves will decrease, which causes increased anxiety and depression. So I've tried to conjecture potentially why. Well, we can't outbeat a tornado or a hurricane. So the warning signals are that animals will get agitated by the environment, know that they have to seek shelter to get out of that element before it comes, right? You hear arthritics say, I know it's going to rain because my joints ache, right? Because the water is not moving and the blood moves by osmotic electrical charge. And so when that happens, even a magnet that has electrical charge won't go together. When it's this way, it goes together. And that's what moves water and blood. So